Thank you for your statement, Minister. The 1,000 Lives campaign has shown what is possible when we are united in the pursuit of a single aim, an aim of improving each patient's experience of the care they receive. The enthusiasm and commitment of healthcare teams is highly admirable. Working together by following an evidence-based approach, they have continued to produce positive results and make significant improvements to patients' experience and safety. We must therefore acknowledge that however hard we try, human error continues to be a fact of life. Therefore, we must continue to explore positive reforms to the management of our health service and at all times prioritise patient care and safety. First of all, we must recognise the scope of any issues and problems and make a clear commitment to change flawed systems which fail patients during their treatment and care. Improving each patient's experience within our Welsh NHS requires everyone within it to work collaboratively with both the patient and their families. A vital component to improving the experiences of patients and staff is cohesion between health services and social care. And where this fails, the consequences can be severe. An example of which I have mentioned in this chamber, but I feel it is important to raise, was the case of the 83-year-old gentleman from my region in South Wales West who underwent major surgery and subsequent treatment. And he experienced the flaws in the system and failed to benefit from collaborative care between health and social services. There simply was no plan when he was released from the hospital, and no one was told he was coming home from the hospital. And he'd had a triple heart bypass at 83 years of age. So, does the Minister therefore agree with me that integration between these services must include streamlining the information patients are obliged to submit, thereby preventing a patient from having to give, as in this case, the same information to multiple agencies and professionals and in the end not achieving the result? Improving the information sharing, which in this case didn't happen, and ensure health and social care services complement each other, establishing greater coordination between the two. Do you consider the role of local authorities in this instance to be positive? What experiences have you had when you've been negotiating, talking to local authorities regarding these issues? And one of the major challenges which faces the smooth transition from health services to social care is the delayed transfers of care. Since the middle of the last decade, we've witnessed rapid improvements in the number of people who experience delays. Indeed, the number has come down from 775 in the quarter ending in December 2004 to 472 in the quarter ending December last year. We all know workforce planning is vitally important, and each health board has stated that the cost of agency staff because of shortages is really eating into their budget and absorbs an awful lot of cost. So this is a huge task, and I ask how you will address this issue, please. Despite this considerable decrease in delayed transfers of care, it is noticeable that since 2010, the number of delayed transfers of care has plateaued. I appreciate that there is always going to be a fluctuation in these figures. However, in 2013, there were 5,393 delayed transfers of care, compared with nearly 6,000 in 2016. So one of the main causes for these delays in the availability of beds since the 2010 number of available beds has decreased by 15%. At a time when Wales is experiencing increasing demands on the NHS service, the provision of beds is fundamental to reducing the number of delayed transfers of care. So the 15% reduction puts further strain on services and has an adverse effect on a patient's experience. So in particular, the elderly people are suffering delays in their care, often left in hospital, because there is no place for them to go. So services which in recent years have experienced cuts to their budget, exacerbating the problem further. Does the Minister agree with me that the Welsh Government must address the number of readily available beds to relieve pressure on the Welsh in Welsh hospitals, and furthermore do everything within its power to prevent the closure of care homes across Wales? Cuts to social service budgets has placed greater pressure on social care when patients are transferred from hospital. This is especially relevant to the elderly, many of whom experience a delay in their transfer and are reliant, therefore, on social services for the essential support that they receive. For example, Cardiff City Council faces severe cuts to its budget over the next 3 years. The Council has already made £200 million worth of savings in the last 10 years. If further cuts are to be made to council budgets such as Cardiff, then the capabilities of social services are going to be increasingly restricted, leaving many patients, both young and old, without essential care. If social services are unable to keep up with the demand, then there is inevitably going to be a knock-on effect on the availability of beds in hospitals. So this has a further effect on the transfer of care, causing greater obstacles to providing integrated care services. As councils, not just here in Cardiff, but throughout the whole of Wales, face economically challenging times, will the Minister prioritise vital funding for the provision of social care for the elderly and the most vulnerable in our society, and consider the recommendations I gave earlier in my speech, ensuring all in our health service benefit from collaborative health and social care? Thank you.
Thank you very much for those questions, and begin by also recognising your comments, particularly on the enthusiasm and commitment of the people who are working on the front line in health and social care. And I've seen that for myself when I visited many of the ICF projects which are taking place across Wales. And I'd certainly, as always, encourage members to go and visit the projects to be inspired by the kind of innovative working and sheer enthusiasm that people have working on the ground through the ICF. And also, you said about the importance of prioritising the individual, and that's exactly what the Social Services and Wellbeing Act sets out to do, in the sense that it puts the individual at the heart of the decisions that are made about them. It's about personal outcomes, having that what matters conversation with them to understand what it is that the individual would like to achieve, and understanding that they are equal experts alongside the professionals. They're the expert in their lives, so they should be treated as equal experts in those conversations. You also made the point that the cohesion of health and social services is absolutely crucial, and I couldn't agree with you more. You gave a very distressing case as an example of why it's so important that we do have cohesion between health and social services. And again, this is something that the Integrated Care Fund seeks to deliver. For example, in Cwm Taf, they've spent £1 million to develop a Stay Well at Home service, and that's operated 7 days a week, 365 days a year. And it consists of a multidisciplinary team based at the hospital in the Royal Glamorgan and Prince Charles. And though they undertake initial assessments of individuals and commission or provide health, social care and third sector community support to facilitate the safe and timely return home of people and prevent unnecessary admission in the first place. So making sure that people do have that wide package of support around them, taking in health, social care and the third sector to ensure that there is a package to allow people to stay home. You also talked about the importance of people not having to give their story many times, because that can be distressing, and there's absolutely no need for it, in the time when we have such access to technology and so on. And that actually is one of the things that they're using in the Stay Well at Home service in Cwm Taf. But we've also invested £2 million of the ICF this year, specifically in the Welsh Community Care Information System. And that's gone live between health and social services in Powys in the first instance, so they have access to the same kind of information. And I was happy to launch that particular initiative fairly recently, and had the opportunity to talk to staff who'd said what a difference it makes to be able to access the information about the individual on the same level between health and social services. It's gone live also in local authorities in Bridgend, Anglesey, Gwynedd, Vale of Glamorgan, Ceredigion and Torfaen. Powys is the only area where it's fully integrated at the moment, but we are moving towards that, and provided 6.7 million of capital funding actually for the initial setup and costs for an All Wales licence, just demonstrating the priority that we are putting on that particular initiative. I'm not sure I recognise the figures that you quoted on detox in terms of them being up-to-date figures, because they have certainly decreased again since the figures that you quoted to us. The total now is 7% down on the same period last year, and in common with all the totals actually in the current year, it's lower than any of the totals reported in the previous 2 years for the same months. So we are certainly making good progress, and this is at a time when individuals' needs are escalating as we have an ageing population and so on. So I think this is certainly an area where we are making very good progress. One of the things that interested me when I first came into post in terms of delayed transfers of care was the fact that actually a large number of the delays are down to an individual's choice, so not being able to access their first choice care home, for example. Lots and lots of the delays are down to that, which is why the Regulation and Inspection of Social Care Act is so important in terms of driving up standards right across the sector, so that people don't have such a difficult choice to make when they're weighing up the choices between two different care homes. Actually, we want to have a care home sector where all of the care homes are attractive to the individual, so there won't be such reticence in terms of making those difficult choices as well.
Hannah Blair.